Shock. The term shock may refer to the psychological or the physiological type of shock. The psychological shock is caused by the traumatic event and it also known as the acute stress disorder. This type of shock causes a strong emotional response and may cause the physical responses as well. The focus of this article is on the multiple causes of the physiologic shock. Your body experiences a shock when you don't have the enough blood circulating through your system to keep the organs and tissues functioning properly. So here we can look at it can be caused by any injury or the condition that affects the flow of blood through your body. Shock can lead to the multiple organ failure as well as the life-threatening complication. There are many types of shock. They fall under the four main categories based on what has affected the flow of blood. The four major types are: one is obstructive shock, and another one is cardiogenic shock, third one is the distributive shock, and the fourth one is the hypovolemic shock. Here we can look at what are the signs and symptoms of shock. If you go into the shock, you may experience one or more of the following. You may feel the rapid, weak or absent in the pulsation. You have the irregular heartbeat, rapid shallow breathing, lightheadedness, cool clammy skin and the dilated pupils. And you also have the chest pain, nausea, confusion, anxiety, decrease in the urine, thirst and the dry mouth, and people used to have the low blood sugar and the loss of consciousness. What causes the shock to occur? So anything that affects the flow of blood through your body can cause the shock. Some causes of shock include: you may have the severe allergic reaction. People have the blood loss. They may also have the heart failure, blood infection, and the dehydration, poisoning, and the burns. So we can look here at the what are the major types of shock. There are four major types of shock, each of which can be caused by the number of different events. As I said before, the first one is the obstructive shock. This occurs when the blood can't get where it needs to go. A pulmonary embolism is a one condition that may cause an interruption to the blood flow. Condition that can cause the buildup of air or the fluid in the chest cavity can also lead to the obstructive shock. This includes the pneumothorax, collapsed lung, and the hemothorax, that is, the blood collects in the space between the chest wall and the lungs, and the cardiac tamponade, that is, blood or the fluid fill the space between the sac that surrounds the heart and the heart muscle. And the next one is the cardiogenic shock. That is, damage to your heart can decrease the blood flow to your body. This leads to the cardiogenic shock. The common causes of the cardiogenic shock include damage to your heart muscle. You may also feel the irregular heart rhythm and very slow heart rhythm. And the third type is the distributive shock. Condition that cause your blood vessel to lose their tone can cause the distributive shock. When your blood vessel lose their tone, they can become so open and floppy that can enough blood pressure is not supplied your organs. Distributive shock can result in the symptoms including the flushing, low blood pressure and the consciousness. There are a number of types of distributive shock including the following. One is the anaphylactic shock. This is a complication of the severe allergic reaction known as the anaphylaxis. Allergic reaction occur when your body mistakenly treats a harmless substance as harmful. This triggers a dangerous immune response. Anaphylaxis is usually caused by the allergic reaction to food, insect, venom, medication or the latex. Another one is the septic shock. This is another form of distributive shock, sepsis. This is also known as the blood poisoning. This is a condition caused by infection that lead to the bacteria entering your bloodstream. Septic shock occurs when bacteria and their toxins causes the serious damage to the tissues or the organs in your body. Neurogenic shock. This is caused by the damage to the central nervous system, usually a spinal cord injury. This causes the blood vessel to dilate and the skin may feel warm and flushed. The heart rate flows and the blood pressure drops very low. Drug toxicities and the brain injuries can also lead to the distributive shock. Hypovolemic shock is the second type. This happens when there isn't enough blood in your blood vessel to carry the oxygen to your organs. This can be caused by the severe blood loss. For example, from the injuries, your blood delivers oxygen and the vital nutrients to your organs. If you lose too much of blood, your organs can't function properly. This causes a serious dehydration and also causes this type of shock. Here we can look how the shock is determined. First, responders and the doctors often recognize the shock by its external symptoms. They may also check for low blood pressure, weak pulse, rapid heartbeat, and once they have diagnosed the shock, their first priority is to provide the life-saving treatment to get the blood circulating through the body as quickly as possible. This can be done by giving the fluid, drugs and the blood products and the supportive care. It won't resolve unless they can find and treat the cause. Once you are stable, your doctor can treat to diagnose the cause of shock. To do so, they may order one or more tests such as imaging or the blood test. Here we can look what are all the imaging tests. Your doctor may order imaging tests to check for injuries or the damage to your internal tissues and the organs such as bone fracture, organ fracture, or rupture, the muscle or the tendon tear, abnormal growth. Such tests include the ultrasound, X-ray, CT scan and MRI scan. Here what are all the blood tests we can take is for the signs of significant blood loss and the infection in your blood and the drug or the medication overdose. How is shock treated? Shock can lead to the unconsciousness, breathing problems and even cardiac arrest. If you suspect that you are experiencing the shock, get the medical help immediately. If you suspect that someone else has gone into shock, call 911 and then provide the first aid treatment until the professional help arrives. Here we can look what are all the first aid treatment. If you suspect someone has gone to the shock, call 911, then follow these steps. If they are unconscious, check to see if they are still breathing and have a heartbeat. If you don't detect the breathing or the heartbeat, then begin the CPR. If they are breathing, lay them down on their back. Elevate their feet at least 12 inches above the ground. This position, known as the shock position, helps the direct blood to the vital organs where it is most needed. Cover them with a blanket or the extra clothing to help them keep warm. Check their breathing and heart rate regularly for changes. If you suspect a person has injured their head, neck or back, avoid moving them. Apply first aid to any visible wounds. If you suspect the person is experiencing an allergic reaction, ask them if they have an epinephrine auto injector. People with severe allergies often carry this device. It contains an easy to inject needle with a dose of hormone called the epinephrine. You can use it to treat the anaphylaxis. And we can see the medical care here. Your doctor's treatment plan for the shock will depend on the cause of your condition. Different types of shock are treated differently. For example, your doctor may use the epinephrine and the other drugs to treat the anaphylactic shock. Blood transfusion to replace the lost blood and they treat the hypovolemic shock. Medications, heart surgeries and other intervention to treat the cardiogenic shock. Antibiotics to treat the septic shock. Can you fully recover from shock? Is this a question most probably asked by many patients? It is possible to fully recover from shock, but if it is treated quickly enough, shock can lead to the permanent organ damage, disability and even death. It's critical to call 911 immediately if you suspect that you or someone you are with is experiencing shock. Your chances of recovery and the long-term outlook depend on many factors, including the cause of shock, the length of time you were in shock, the area and the extent of organ damage that you have sustained, the treatment and the care that you received, and your age and the medical history is most important. So, what are all the prevention we can take to avoid the shock? Some forms and the cases of shock are preventable. Take steps to lead a safe and healthy lifestyle. For example, if you have been diagnosed with the severe allergies, avoid your triggers, carry an epinephrine and the injector and set it to the first sign of the anaphylactic reaction. To lower your risk of blood loss from the injuries, wear the protective gear when taking part in contact sports and riding your bike, and using the dangerous equipment, wear the seat belt when traveling in the motor vehicles. To lower your chances of the heart damage, eat a well balanced diet, exercise regularly, and avoid smoking and the secondhand smoke. So, these are all the preventions you can take for the smoke and the shock. Thank you.